think you all remember this communique, September 27, that was announcing the virus that never happened in this country. And this was a day no one wants to have or experience, but it had happened and we had to assume it and decide what to do, either delay until we have more consequences or act quickly until we contain. And the next day, I remember we all came together as partners. Most of you may remember this picture. And the Minister of Health, when we were sharing the initial information we had about the outbreak, the cases, the transmissions, and even trying to answer a difficult question, where infection came from. It was too early to respond to three important questions. Number one, how do we save the lives of people already infected as quick as possible? Number two, how do we cut these transmissions and stop this virus to spread? And number three, how do we know where it came from so that it doesn't happen again? So these were the three questions, the three missions we had to go through together. And the first weeks were probably the most difficult ones, because this is the time we recorded almost 50 of 66 cases we had throughout this outbreak. Just in 2 weeks, we had 50 of all the cases. And that's the time we had almost 80% of the deaths we recorded, which means the people were infected before we even know, and we're still struggling to even know who had it and who infected who. It was a very difficult time. And as you see on the right side of this slide, healthcare providers were the most infected, the top bar, meaning that this new cluster, this cluster of infection in the hospital, in the ICU, was actually still infecting healthcare providers who were exposed and the cases we were treating. Weeks later, we started to see a positive trend from the third week, fourth, until we started to see good news coming, one case or no case, even consecutive days, a week without a case, then restarting with a new case when we're hoping that things are getting over. But this type of virus always has a very long tail, like we say in epidemiology. So we continued to understand where infection came from. It was very difficult. First 10 days, we're trying to see if it may have a link with the recent outbreak in neighboring country, Tanzania, in the east. And most of our efforts were going to east, because we had some links to the east, especially with a case that had traveled from the east, from a refugee camp, and linked to the initial cases. So all our efforts were towards east, trying to link it with the cross-border transmission. That took us a week, 10 days. We found no link. Then we had to go back and retreat and restart from scratch from the files and see how can we trace the origin of infection from even backwards, not just September. What if the infection came in August? What if the infection came in July and we didn't know? So we went at that level from July 1st, reviewing every single patient file in the hospital that was most affected. And that helped us to find the starting point towards the index case that we updated you before, but I'm repeating it in case someone wasn't here at that time, previous briefing. So by reviewing 120 patient files that were admitted in the ICU at King Faisal Hospital, we found one case was clearly an MVD that was not detected by then. By doing a contact tracing for that case that unfortunately had passed, it took us to the cave where we found this 27-year-old male who was working in the mining site, was still alive, but we didn't know he had contracted this virus and infected a spouse and end up into ICU. And that took us to the cave, to the bats, to the lab diagnostics, from PCR, serology, antibody testing, to the sequencing, to connect all these points. That is how we managed to find the index case into the cave, not far, not the east actually, closer than we thought. And this for us was an answer to the third question, where infection came from. And that started another journey of trying to now build a stronger surveillance on the bats, not just in this cave, but across the country. So identified in all mining sites, in all caves in Rwanda, about 50 caves or mining sites where bats were closer to people and where, if we had delayed more, could have started another new infections. So now we have mapped all the sites, and this is it's not one-time activity. It will continue, and we're going to do this surveillance on a regular basis, especially that we know more about bats, their behaviors, and how the birthing twice a year in February and August, that's the time they shed more viruses, that's the time we have more risks to acquire infections. That's the time most outbreaks actually had happened in the past in the region. So these are new knowledge we have been pulling together by digging deep and understanding, trying to answer these three questions. And this also helped us to even trace contacts that we didn't know they were linked, particularly one case that developed symptoms while we were following these miners, more than 1,500. One of them developed symptoms during the follow-up, and he happened to be working in the same tunnel with our index case. And we were lucky to find it by the time he wasn't going to start an infection. So this really was an opportunity to understand and know more how we can build even more stronger surveillance systems in Rwanda and beyond. And we are sharing this because we believe is important for the scientific community for better preparedness and response. Let me talk about the case management. Again, here we've seen a change in the trend in the previous statistics that if someone is infected from Marburg virus, the survival rate will range between 24 to 88%, and on average 50% of people infected will die from the virus. So our healthcare workers worked hardly to make sure that we get to the lowest of this case fatality rate of 24%. They actually made it even better by going below that global standard. They challenged the standard that were there before for previous outbreaks. We have a case fatality rate of 22.7%. And it didn't happen by chance. It happened because of these people, because of the tools they received, medicine, they received vaccines, everything they tried to save every single life that was in their hand. I use these two pictures because this is a real case of a nurse, a chief nurse actually, at the treatment center. This picture on the right side of the slide that was shared by Dr. Menelas, I don't know if he's in the room, was taken live when this nurse was just after 4 hours spending in full PPE. And it was full of water everywhere, sweating. You can imagine how hot this environment can be and how this job can be tough. And this was just not one day. This was 3 months, 2 months, 3 months, and even now as we speak, they are still following up on survivors, they are on surveillance, on in the ICU for other patients. So the work of healthcare workers is not easy, it's tough. And we're here also to recognize their work. They were brave, they were committed, even facing death with a case fatality rate that high. And we also recognize the lives of those we lost, particularly frontliners, those most experienced healthcare workers. We had a 2 days event to remember and even recognize their role to protect us, to protect our nation, and also to protect the world. And 15 lost their lives, majority are healthcare workers. Their lives will always be remembered because what they did was for us to all be safe and tell this story. As I said, a case fatality rate of 22.7%, never recorded before, was a fact that when you bring in all these efforts, you can even reach better results. And I believe the next outbreak, if as a global community, a global scientist, expert, stakeholders, we can even go to below this number. It's just showing that this is possible with the tools we have and commitment and speed of the response. We are also interested to continue share and work with partners across, and also everyone work to make sure the world is safer. Some of these information are being shared across the world. We have first publication on this genomic transmission dynamics, the sequence done by our teams here with our partners. We understand the importance of sharing this information for better preparedness for us, but also for others. And there are more stories that are going to be written to share in different formats. Now, Marburg is over. What's next? We believe that it's not completely over, as still we have these risks, especially the bats that need to be surveilled. We continue to build these capacities. We build new teams. We build a new strategy moving forward. And even adding on technology to follow these bats, where they're moving, how they behave, who they're visiting, who is interacting with them, and make sure we stop these interactions in One Health context. This is very important. We believe also that survivors of this virus need to be supported, followed. We need to avoid stigma, but at the same time, making sure that those who are affected psychologically, mentally, they still need us, they still need scientific, clinical, to make sure also this virus is completely out of their body and their systems. There are many things we need to do moving forward in surveillance, building lab capacities. What we had was useful to know, but it's not enough to continue. Detect early, especially in ICU, in emergencies. There are new technologies we need to embrace. And as a country, we want to continue to provide our support to ourselves, but also to the continent and beyond, to what we're learning from this viral hemorrhagic fever, as we are the most recently affected. And we don't want this to happen to anyone else if we can provide better tools. Tracking bats, this picture in the middle, actually, I was surprised to see how these fruit bats look like. They can bite. Some people call them, these are small flying dogs. They love to eat fruits. That's why they are called fruit bats. They can, but they live mostly in the cave, hiding in the dark areas. Normally they shouldn't be interacting with people. But when human activity go towards them, it happens what happened. And we need to make sure that we create an environment where bats and humans are not interacting. And most of the cases are humans actually causing these disruptions. And we should be the one creating a safer environment, both animals, environment, and ourselves, to protect ourselves, but also protect these other species, because they are useful. They are useful to our lives. They participate in our agriculture. They participate in protecting us for other outbreaks. Actually, some of these bats eat a lot of insects that, if they are not there, will face other outbreaks like dengue, malaria, and others. So we shouldn't be seeing them as a threat. Actually, they are our protectors in a way, until we disconnect this environment, then it became our problem. So dealing with them, need to understand all this ecosystem. It's not a health issue. It's not agriculture or animal resources issue. It's an issue for all of us to work together. So we're adding new technology, thanks to our partners, to track these bats with GPS. We're starting in a few weeks to make sure that we understand and we know these migrations and movements. And we'll keep you updated on these new developments of surveillance, but also knowing the next outbreak before it happens, before it lands into our hospitals. So I'd like to also mention these two periods, February and August. These are the most critical times, because that's the time these bats are shedding more viruses, at the time they're bursting. And that's the time we will be collecting more samples from these bats across these mines. So we already established this plan. We already have teams ready, equipment. They're calling them batmen, that are going to help us track these species and to protect us, but also to contribute to the global scientific knowledge. So February is soon. There's just 1 month in between. So this work, again, will inform us on how we strongly build our capabilities in preparedness response. I'd like to conclude by saying thank you to all our partners. Thank you to frontliners, and thank you to everyone who made this journey possible, from the day of panic and fear, today we are at the finish line, and the day we're seeing that Marburg can be handled quickly with the tools we have, and with partnership, everything is possible. Thank you very much. Murakoze cyane. I give time now to the video. Thank you.